Today's topic of discussion is systemic effect of inflammation. We need to know that inflammation, even if it is localized, it is usually associated with systemic reaction which is cytokine induced. So this one inflammation, even it is localized, it is usually associated with the systemic reaction which is cytokine induced. This cytokine induced systemic reaction is referred to as acute phase response. So this cytokine induced systemic reaction is known as acute phase response, which is stimulated by bacterial product. So this acute phase response stimulated by bacterial products and other stimuli like tumor necrosis factor, interleukin 1 and 6 and various interferons. So this one stimulated by bacterial products and other stimuli like tumor necrosis factor, interferon 1, 6 and interleukin 1, 6 and some interferons. Next, what is this acute phase response? By understanding that various clinical features associated with acute phase response and various pathological features. So the clinical features include fever. It would be increases pulses and blood pressure. It would be decreased sweating. It would be shivering, that is rigors, or searched for warmth, that is chills, then anorexia, then somnolence and malaise. So what are the clinical features? Increased fever, then increased pulses and blood pressure, then decreased sweating, then rigors, that means shivering, then chills, anorexia, somnolence and malaise. Then what are the pathological features? It include elevated level of acute phase protein and protein investigations which can show thermocytosis, leukocytosis, sometimes in that long-standing causes even anemia. So what are the pathological features? It include elevated level of acute phase protein, then thermocytosis, leukocytosis and anemia. Now what is fever? Fever is basically elevation of body temperature, usually by 1 to 4 degrees Celsius. Okay, so elevation of body temperature usually by 1 to 4 degrees Celsius. The substance that induce fever are referred to as pyrogens. So the substance that induce fever, that one referred to as pyrogens. These pyrogens can be exogenous or endogenous pyrogens. Exogenous pyrogens and endogenous pyrogens. Exogenous pyrogens are basically the product of bacteria. Okay, exogenous pyrogens are product of bacteria, that is lipopolysaccharide, and this bacterial product through the immune cells, and this bacterial product through that immune cells, they help in release of endogenous. So through that immune cells, they help in release of endogenous pyrogens, which are cytokines. Basically they are interleukin 1 and tumor necrosis factor. Now, what does this interleukin 1 and tumor necrosis factors? Now, this interleukin 1 and tumor necrosis factor, what does they will do? These cytokines are the ones which upgrade the cyclooxygenase activities. These cytokines, these are the two cytokines. This one upgrade, that means increase cytooxygenase activity, and then they produced prostaglandin. So they produced prostaglandin. Now what do? They increase cyclooxygenase activity. Basically the vascular and perivascular cells are of that hypothalamus. Okay, hypothalamus, they are more sensitive to this hydrogens because of upregulation. Prostaglandin act on hypothalamus to release various neurotransmitter. The neurotransmitters, okay, that neurotransmitters can causes vasoconstriction, which basically reduced that loss of heat. Okay, vasoconstriction reduced that loss of heat, and through brown fat and skeletal muscles they also increase the heat generation in the body. So the combined effect, vasoconstriction and brown fat and skeletal muscles. Okay, so these two combined effect of reduction of loss of heat and increase heat generation is what reset of body temperature to a higher level, and that is what we refer to as fever. So this is how fever actually happen in case of inflammation. So in the case of inflammation, what are the things will happen? That substance, okay, a substance that induced fever name is called as pyrogen. Two type of pyrogen, exogenous and endogenous. This endogenous is the product of bacteria, that is lipopolysaccharide. This lipopolysaccharide through immune cells they activate these endogenous cytokines, endogenous product cytokines. These cytokines, so through immune cells, they help release of endogenous pyrogen, which are cytokines, that is interleukin 1 and tumor necrosis factor. These two things upgrade cytooxygenase activity. Then they produced prostaglandin. Okay, they synthesis prostaglandin activity. So they act as hypothalamus. They released various, these prostaglandin actors and the hypothalamus. They releasing various neurotransmitter. These neurotransmitter causes vasoconstriction, and through brown sugar and skeletal muscles also they increased heat. So these are the things, our body temperature increasing. So because of that inflammation, here because of that inflammation, our body increasing body temperature. So it is through inhibition of this the cyclooxygenase, okay, inhibition of this cyclooxygenase, we can reduce that fever. So that is where you non-steroidal anti-inflammatory drugs act. Non-steroidal anti-inflammatory drugs act. So other clinical features we already know: increasing pulse rate, increasing blood pressure, and they will be sweating, which is decreased. Then decreases sweating because of redirection of that blood flow from that cutaneous to that T vascular beds. Once that happen, it minimizes the loss of heat through the skin, and that is why there is decreased sweating. Patient can also manifest it with the increased shivering, which we refer to as rigors. Then patient can search for warmth, which is referred to as chills. There will be loss of appetite, which is referred to as anorexia. They feel sleepy, they feel drowsy, which is referred to as somnolence. Okay, when that patient feel drowsy or sleepy, that condition name is called as somnolence. Then malaise is a vague discomfort which is happening to this particular patient. So all these are the systemic effect of inflammation. All these are clinical picture of acute phase response. We already know this one, pathological features, elevated level of acute protein phase, then thermocytosis, leukocytosis, and anemia. Now, what is acute phase protein? That acute phase protein or plasma protein which are synthesized by the liver. Okay, so acute phase protein which are plasma protein which are synthesized by liver as a part of responsible to these inflammatory stimuli. So this one as the part of response to these inflammatory stimuli. We know that because of inflammation there is release of various cytokines. Cytokines in the form of interleukin 1, interleukin 6 and interleukin 1, interleukin 6 and tumor necrosis factor. And now these interleukin 6 stimulate that liver to produce 2 plasma protein. This interleukin 6 producing 2 plasma protein which are C-reactive protein commonly called CRP and fibrinogen. This interleukin 1 and tumor necrosis factor help in the synthesis of serum amyloid protein SAM. So these are the 3 important acute phase protein. What are the 3 important acute phase protein? Interleukin, this C-reactive protein and fibrinogen. Then this serum amyloid proteins. And so this CRP and this serum amyloid protein SAA, these two things, okay, CRP and SAA bind to microbial cell wall. This CRP and SAA basically have this similar function. Both are having this one and this one having similar function. Bind to microbial cell wall and they act as opsonins. Okay, opsonins, they act as opsonins. What is opsonins? These proteins go and bind on the microbial cell wall and they help the phagocytes, they help the macrophages to identify these microbial cells and they help in phagocytosis. So here what are the things these opsonins will do? This is the protein go and bind with the microbial cell wall which help phagocytosis. They help the macrophages to identify that microbial cells. So help in phagocytosis. And then another function, they also bind to chromatin. So they also bind with chromatin which help in clearing of necrotic other dead cells. So what is the role? Clear. So what is the role of that chromatin? They help to clear necrotic dead cells. So basically these are the beneficial effect. Okay, these are the beneficial effect of this acute phase protein. So this CRP and serum amyloid protein both are having similar function, bind to microbial cell wall and act as opsonization. That means they helping for phagocytosis process. Another one is bind to chromatin, help for clear other dead necrotic cells. So these are the basics, beneficial effect of acute phase proteins. What does that fibrinogen do? The fibrinogen bind with the RBC. Because of binding of fibrinogen to RBC, that result increasing that Rolex formation. That is the stocking of RBC. So, when you estimate an erythrocyte sedimentation rate, ESR rate increases. So, this is that reason for increasing ESR in the case of inflammation. That is the mechanism why ESR rate increasing in inflammatory state, because that fibrinogen bind our RBC and formation of Rolex. You know the stage of ESR, erythrocyte sedimentation rate. One of the stage is the formation of this Rolex, then sedimentation. Now we know the beneficial effect of active phase reactant protein. We also should know what are the harmful effect of elevated acute phase protein. So these are the what are the harmful effect of elevated acute protein phase. If the inflammation is prolonged, if that inflammation is prolonged, so there will be prolonged production of SAA, serum amyloid proteins, and that result in a condition is called that amyloidosis, which is secondary amyloidosis. So what are the harmful effect? When that inflammation is prolonged, there will be prolonged production of serum amyloid protein. That result in a condition is called amyloidosis, which is secondary amyloidosis. Another thing is known as patient with elevated CRP, C reactive protein level elevated. That are the ones who have increased risk of that myocardial infarction in that patient with coronary heart disease. Now there are other protein which are synthesized by the liver. They are hepcidin and thrombopoietin. Apart from three acute phase protein, these two are important. They are hepcidin and thermopoietin. Thermopoietin is the major growth factor for this one is the major growth factor for megakaryocytes. They help in stimulation of more and more platelet. That's why we find more and more platelet in that peripheral smear, that is thermocytosis. That condition name is called thermocytosis. This hepcidin is one which reduce that availability of iron to erythroid precursors. Iron is an important component for the production of heme. Therefore, that hemoglobin and RBC, which produced by this iron deficient erythroid precursor, as will be anemic. And that is the reason for anemia in case of chronic inflammation. This is important entity which is referred to as anemia. anemia of chronic inflammation, which is mainly due to production of hepcidin, which reduce that availability of iron to that erythroid progenitors. We knows already three important protein. What are the proteins? CRP, fibrinogen, then serum amyloid protein. Two more important proteins. Okay, other protein released by liver, hepcidin and thermopoietin. Hepcidin reduce that availability of iron to erythroid progenitor. This one leads to anemia. This thermopoietin is the major growth factor for macrokaryocytes. This one leads to thermocytosis. Other laboratory findings, leukocytosis. What is leukocytosis? Other laboratory findings are leukocytosis. How does leukocytosis, okay, this one, how that leukocytosis happen? Again, that same cytokines uh, play a major role. The cytokines like tumor necrosis factor and interleukin 1, they accelerate the release of granulocytes from bone marrow, which can result in leukocytosis. Other than that, in case of prolonged infection, the macrophages are activated, and also stromal cells in the bone marrow are activated, and these activated macrophages and marrow stromal cells increase the production of colony stimulating factor. There is increased proliferation of precursors. So all these things, the combined effect is manifested as leukocytosis and leukemide reaction. These cytokines, tumor necrosis factor and interleukin 1, accelerate the release of granulocytes from bone marrow, and prolonged inflammation activated macrophages and marrow stromal cells. This one increase colony stimulating factor as well as increase proliferation of precursors. These two things will leads to uh, combined effect of these two things, combined effect in manifested as leukocytosis and leukemide reactions. Leukocytosis, it is increasing leukocytes count, the normal leukocytes count being 4000 to 11000 cubic mm. Okay, 4000 to 11000 cells per cubic mm. Anything is more than 11000 in a normal adult name is called as leukocytosis. That leukemide reaction means the increase is so much that is sometimes resemble that of leukemia, but it is not leukemia by definition, by criteria, hence it is called as leukemide reaction. So here the count will be around 50,000 to 1 lakh cell cubic mm. It is not leukemia, it is in between leukocytosis and leukemia reaction. So that reaction name is called as leukemide reaction. So that count around 50,000 to 1 lakh. The bacterial infection are the one which can give rise to neutrophilia. The viral infection are one which can give rise to lymphocytosis. Bacterial infection, neutrophilia; viral infection, lymphocytosis. That is increasing the lymphocytes count, related lymphocytes count. Okay. The eosinophilia is seen most commonly in allergic condition and parasitic infestation. Some infection like the typhoid, a few viral infection, rickettsial infection, some protozoan infection. What happened in this infection is that there will be sequestration of activated leukocytes in vascular space and tissue. That result decrease leukocytes count. So there they actually manifested with leukopenia. So here what is the condition? Decrease leukocytes count. So it is called as leukopenia. It is also manifestation of inflammation. Some of these conditions, so bacterial infection, neutrophilia; viral infection, lymphocytosis; eosinophilia means allergic and parasitic infection; typhoid, viral infection; rickettsial infection means what is the things happen? Sequestration of activated lymphocytes in vascular space. Result decrease leukocytes count. So it is called as leukopenia. Like typhoid, flu, viral fever, rickettsial infection and protozoan infection. Now what happen if that inflammation is extremely severe? Okay, extremely severe, it result in more and more production of cytokines, and more production of cytokines will be more harmful to the body. That result sometimes called disseminated intravascular coagulations, and can progresses to hypotensive shock and various metabolic disturbance. So these collectively is referred to as septic shock, or also referred to as systemic inflammatory response syndrome, SIRS. So in this video discussed the systemic effect of inflammation. What is inflammation? Associated with the systemic reaction which is cytokines induced. So what are the stimuli? Tumor necrosis factor, interleukin 1 and 6, acute phase response, clinical future and pathological futures. Fever time 1 to 4 degrees Celsius induce. That induce substance name is called as pyrogen. Two type of pyrogen, exogenous and endogenous. Exogenous, that lipopolysaccharide through immune system, it will induce cytokines. So here upgrade cyclooxygenase activity, so increasing prostaglandin activity. So it release various neurotransmitter, causes vasoconstriction and through brown fat and skeletal muscles. This one increasing body temperature, that is fever. Then other clinical features. Then what is acute phase protein? It is synthesized by liver. So three type of protein: C-reactive protein, fibrinogen and serum amyloid protein. Then what are the harmful effects? Prolonged production of SAA leads to amyloidosis, elevated CRP, increased risk of MI patient. Other important protein, hepcidin and thermopoietin. So hepcidin causes anemia. This one will leads to thermocytosis. Then other clinical features, cytokines and prolonged infection leads to leukocytosis and leukemioid reaction. Bacterial infection, neutrophilia; viral infection, lymphocytosis; allergic means eosinophilia. Then severe infection means severe increases cytokines, leads to septic shock and systemic inflammatory response syndromes. Thanks for watching.